In tonight's 7 UpFront segment, we're taking a closer look at mental health during the pandemic. The shutdown and restrictions during the pandemic is taking a toll on families all across Metro Detroit area. So joining us tonight with more on this discussion, Dr. Aaron Hunter, who's the interim director of the University Center for Child and Family at U of M. Thank you for being here, Doctor.
Thank you for having me.
So let's begin with some of the simple things that we can do to help ourselves support our families during these difficult times.
I mean, I think the thing to remember is that, even with all the positives that we were just saying, where there's more vaccines, there's vaccine centers getting up, U of M is planning for some, much more on campus, that we are also here a year later in a much more hopeful spot, but some of our day-to-day realities are still very similar to where we were a year ago. And that is really, really draining. So I think one of the number one things to do is be kind to yourself and your family that you've been spending much more time with, or your roommates or whoever it might be over the last year. And, just let yourself be compassionate to yourself and to others, because this is hard and our coping resources are not built to be able to manage this amount of stress. And we're all going to crack at times, and just going one thing at a time with as much grace and compassion as possible.
And that is some great advice, to just try to count to 10 and take that moment to be kind and not say what you may want to say in an instant. We do know that, our children also affected during this time. So how can we tell whether they have trouble coping? If there's some warning signs you can help us with.
Yeah, and I think the thing is, kids at different ages are also, of course, going to show the effects of stress and anxiety in different ways. Sometimes kids might actually directly say, like, I'm feeling really stressed out by this, or, I'm a mother and I have 2 kids myself. And what my 9-year-old the other day, when he woke up, said, I'm going to go back to bed, wake me up when the pandemic's over. So he's able to say that pretty clearly. He said he wanted to make a t-shirt out of it too, which would probably sell pretty well. Many people probably feeling similarly, but younger kids and even older kids, even us adults, sometimes when we are feeling the effects of stress or anxiety, we might not always be aware, especially when we're trying to balance a whole lot of things all at once. So sometimes that stress can come out as irritability, or maybe as a behavioral issue. So kids might be hitting their siblings more often. They might be hitting their parents. They might be more mean or just grumpy. They might be withdrawing and wanting to spend more time alone in the room, or more time with their headphones or their hoodies up, or both. And I think just keeping in mind that, again, that all of this, that there's many different ways that kids are going to show this. And I think for parents too, our job is not to fix our kids' feelings. Feelings aren't something that to be fixed. Feelings are messages that our bodies are giving us that something important is going on for us to address. So parents don't need to fix or take away any of the hard experiences. It's not even possible to do so. But what we can do is support them through it. Give them space to just, even say, like, this is hard. Sit with them, and that, what all of us are going through is really hard. It's really frustrating. I wish this was over now too. And I'm here with you. Do you want to talk about it? Do you want to not talk about it and read a Calvin and Hobbes comic book? It's more about the creating space than trying to fix it or jump over the feeling.
Yeah, this one's out of our hands as parents. We can't fix it. Being a teenager, it's hard enough as it is during these times. So the teens, you mentioned hoodies up and being withdrawn. What can families do with them to help them work through the pandemic?
Well, I think with teens, one of the hardest things too is that teens are meant to be really social. Like, the teen years are a time where you're, developmentally spending, supposed to be spending much more time with your peer group, figuring out who you are by doing a whole bunch of exploring, trying out clubs, trying out new activities, trying out, different types of friends. And I think that the pandemic has really hit teenagers some of the hardest of anybody, because it's just, there's such limited opportunities for that socialization and identity exploration. So in terms of supporting teens, I think even what I said before, like just giving space and not trying to fix it for them, but kind of listening or just sitting with them as it's a hard time. And maybe helping them kind of, as much as possible, creatively think about how to connect and how to do some of that exploration. There are lots of resources online, although I know a lot of people are also sick of anything that's online, but Maybe it's even checking out books from the library. Maybe it's talking to other people. But I think there's a lot of online groups, online supports, and more things moving in person too. So just figuring out how they can get that connection, how they can have a hobby and interest and explore as much as possible.
Dr. Hunter, thank you so much. Let us know when your 9-year-old prints that T-shirt. Hope you have a good weekend, and we appreciate your advice.
Thank you very much. Take care, all of you.
All right, Dave.